Are we ready? Cool. Okay. Hello, thank you for joining us today. We're the Cal State San Marcos nursing class students, and we're working on our leadership project, and we worked on a postpartum acuity tool. And so our focus was to create a tool that could better assist charge nurses with creating staff assignments that are based on the specific acuities of the postpartum unit, and to develop an acuity score chart that reflects the demands of the unit based on RN feedback and current research and best practice, and to implement the tool on the unit and to make adjustments according to its early adoption.
Okay, so while researching patient acuity, there's really no legislation or laws that require the use of patient acuity while creating assignments. So the closest thing to acuity is the AWHONN staffing standards, which suggests one nurse to no more than 3 mother baby couplets. So patient ratios are an important start to looking into acuities because it sets the standard for what the minimum adequate staffing is in order to keep patients safe. So acuity is another layer that we hope to address with our intervention. So the identified issue is the lack of an objective patient acuity tool. So without a standardized system, charge nurses often have to rely on subjective judgment when making patient assignments. So this can lead to inequitable workloads and potentially compromised care. So it's important because by introducing a standardized patient acuity tool, it allows charge nurses to take out the guesswork of patient acuity. Also, the intention behind the acuity tool is to create a safer environment for both the nurse and the patient because it creates more equitable workloads, and therefore nurses are not overstretched and are able to provide better care for their patients. So through our literature review, it was a resounding positive outlook when acuities were used to create staffing assignments. It is suggested to create acuities that are specific to a floor as there are unique needs of each floor, and especially in a postpartum unit because it is a unique patient population. So specific outcomes from the research include decreased mortality, adverse events, and length of stay. Also balanced nursing workload with improved satisfaction, patient safety, quality of patient care, and potentially can reduce cost.
So looking at research and a literature review called Implementing a Patient Acuity Tool, Perceived Effectiveness for More Equitable Staff Assignments, they realized that there is a lack of adequate staffing result in missed nursing care, insufficient time for critical thinking, and unsafe nurse-to-patient ratios, which lead to increased length of stay, complications that could have adverse events. So if you just look at and do a fixed nurse-patient ratio and you fail to look at acuity of each patient, then it could lead to this. The factors that were included, if you did an acuity tool, would be improved nursing resources about acuity measurement tools, improving nursing care units where nurse staffing could adjust based on patient changes, and a balanced work load. And so this study that I was looking at aimed to assess accessibility, relevance, and effectiveness of a patient acuity tool among part-time and full-time RNs. So they did this on 33 RNs who participated in pre and post tasks, and what they found out is that they really did enjoy an acuity tool that would help them feel like they were that it was equitable among all the RNs. And in 2008, there was an Allen survey result, which was, it was aimed to learn who made nurse-patient assignments, how they learned to make them, and if satisfaction with assignments affected call-offs and turnover. So what they found out is that 91% reported that daily assignments were important to job satisfaction. They also reported that 41% knew someone who called out sick because of assignments, and 74% reported they knew someone who transferred or left their position because of unhappiness with their nurse-patient ratios and multiple high acuity assignments. So the results, so there is a correlation between nurse-patient assignments and nurse perceived satisfaction. And so what they found out is that acuity tools should be specific for a nursing unit and adapt to staffing and patient needs, which can include a change in patient condition, unexpected discharges, admission, and psychosocial support. And who are the stakeholders? Everyone involved really is the stakeholder here. The charge nurses, the bedside nurses, hospital leadership, unit educators, and patients, because in particularly in the military hospital setting where staff turnover and varying levels of experience are common, implementing a standardized patient acuity list can enhance consistency, support clinical decision making, promote patient safety and a more balanced care environment.
So when we're talking about quality improvement, we're looking at quality outcomes and quality variance. Quality outcomes are kind of what we expect to happen with the implementation of the Acuity tools. So we expect that assignments made with the Acuity tools should have a more balanced distribution of patient care workload due to better understanding and visualization of patient acuity for both mom and for baby. When we use the patient acuity tools and acuity is taken into account, we should see a better distribution of acuity scores and patient assignments, and we should be able to see positive patient outcomes related to a better distribution of time spent between the nurse and each of their patients. The use of these tools should lead to an increased understanding of the rationale behind why certain patients get certain acuity scores and which patients should and should not be grouped together. This helps newer charge nurses visualize the tasks that each patient may need on their day of care, and can help maintain accountability and fairness in patient assignments and also identify errors before they happen. With quality variance, we're looking at how might we anticipate performance to vary without the use of the acuity tools. So there is an expected adjustment period to using the patient acuity tool, which can lead to inconsistencies in creating balanced patient assignments. We need to account for the time for nurses to get used to the tool, in learning how to score the patients accurately and also understanding how to pair them together. When the tool is not implemented, we might see that patients' assignments run the risk of being more imbalanced, which can lead to burnout, less time spent with the patient, decreased quality of care, and failing to meet patient outcomes.
Okay, so the 5 whys. So this is a cause and effect tool that tries to single out the root of the problem. It starts by identifying the problem and then asking why until you get down to the root of the problem. So the problem is nurses in the postpartum unit are experiencing an imbalanced workload with some assigned multiple high acuity patients during their shift. The first why. Burnout and compassion fatigue are prevalent when workloads are heavy, which can cause a decrease in quality care and or safety issues. Okay, so we move down to what causes that. The second why, caused by unbalanced staff workload assignments with one nurse getting multiple high acuity patients/couplets during their shift. Third why, there is no objective patient acuity tool in place currently to guide charge nurses to appropriate and equitable nurse-patient assignments. Fourth one, the EHR system does not have a standardized postpartum acuity-based assignment tool in its software and or the absence of specialized training for charge nurses on how to evenly distribute balanced nurse assignments. And the fifth why, so this would be the root of the problem. There has not yet been a formal process to evaluate and to identify the specific acuity indicators unique to postpartum care that would support the creation of a consistent assignment tool in the EHR system.
Okay, so this was our survey. We used Google Forms, and we sent out the survey to the nurses on the unit, and it had the current acuity list for endpoints for mom, and then the current acuity list and points for baby, and then we asked if they would like to add, change, keep anything for mom or baby, and if they saw this as a valuable tool or not on the unit. And so for our results, what would they like to add to our current mother acuity list? Magnesium was the number 1, but we agreed that there just needed to be a little bit more clarification, because though magnesium wasn't like specifically on the list, the actions that come along with a patient that is on magnesium is on the list, so it just kind of needs to be clarified. But then also post C-section ambulation and then insulin were also some concerns that RNs had with mother acuity. And then with baby, it was a tie between infants on DEX versus subgleal, and then planned procedures, and then wean and feed. And then we got 100% yes that that nurses that took the survey would agree that the point system, with the point system and how it was scored. And so with the information provided from our survey and with feedback from the unit division officer, we developed an acuity point system to assist the charge nurses with creating balanced assignments for the oncoming shift. And the goal was to create a system that was quick and easy for charge nurses because they already have so much going on and are pulled left and right. We really didn't want to add a whole lot extra to their shift to complete more balanced assignments. So it ended up looking like this. So we added the scoring guide to the bottom of the shift report that is available to the charges on a document that they're already utilizing. So we weren't adding an additional document for them to use. So this is the shift report, and then here's the scoring guide on the bottom in red. And then to the left, we have the acuity score in green, and so mom and baby got a score, and that would help with the shift report. And so then responses after implementation. So since adopting the acuity tool, has there been any ease in assigning patients? We got 20% no, but 80% yes, so that's good. And then for nurses who do not frequently work as charged in the MIU, if you are not familiar with the MIU unit, do you feel like making patient assignments, that this helps with making assignments? And we got 100% yes.
Okay, so we want to be able to measure our goals and analyze them to our needs. So one of the goals is nurses' workload balance. We can conduct pre and post implementation surveys to see how it's going and then adjust accordingly. And then patient safety outcome, we can track safety key indicators such as medication delays, postpartum complications, missed assessments, and incident reports, and see if there is a decrease in those categories. And then another goal would be assignment efficiency. We can go as far as, see if there's a decrease in time it takes to complete shift assignments before and after the acuity list. And we can also see if the confidence in decision making, especially among less experienced charge nurses, goes up. So what's at stake? The hospital, the nurses, everyone involved has a stake to this. In postpartum care, hospitals and nurses can face lawsuits due to medical negligence or malpractice that results in harm to the mother or child. Common causes of lawsuits are failure to assess or respond to complications, failure to monitor, communication breakdown that leads to missed opportunities for timely interventions, infections, medication errors, and inadequate staffing or training. For example, California Department of Public Health versus Garden Grove Hospital in 2014. They failed to properly and effectively communicate between nurses and doctors that led to the death of a 26-year-old woman due to hemorrhage after a C-section. The hospital, the nurses, and the doctors were held accountable, and the government said that they had an inability to prevent and treat the severe postpartum hemorrhage, and it all came down to just communication breakdown and just not following through.
So what are our next steps for the project? At this point, we've evaluated the effectiveness for the short-term use of the acuity tool, but we also want to look at the long-term effectiveness and make sure that we're still maintaining the same level of efficacy. And we can do this by continuing to conduct follow-up surveys. And this leads into our next step, which is to make changes as they occur to the current version of the patient acuity tool as changes are identified. So some of the questions that we want to ask are there additional tasks that the team believes should be added to the tool, and are there additional tasks that may not be as helpful, and assessing for misinterpretation as well. We want to make sure that everyone is on the same page, and if there is miscommunication going on with how to use the tool, how are we going to address and educate those gaps. And so we also want to address the issue of using old methods in assigning patients to nurses. We want to reiterate the importance and usefulness of the tool in creating patient assignments, and we can do this through visual reminders, so including that acuity scoring sheet on the report sheet as well. And possible weaknesses for the system include manual assigning of points, charge nurse preoccupation, and needing more staff RNs to balance the workload. And thank you for watching our presentation.
Thank you, guys. Does anybody have any questions?
Have you guys started this?
Yes.
Is it working?
It seems to be, especially
Yeah.
with the new grads, the
Yeah.
new, like, not new grad, but like my new nurses,
nurses.
my first,
Yeah, it
my
looks-
brand new charge nurses.
Yeah. It looks like it's super helpful.
Yeah. So, all right. Well, we thank the department heads for being here, and we thank you guys for doing our tool. It helps us out every time we get help with our projects. So,
Thank you.
thank you.
Thank you.
Thank you.